Sharp pain in the ear, causes and symptoms. A sharp pain in the ear is a common sensation. It is not usually harmful, though it can cause concern. The medical name for ear pain is otalgia. If the pain comes from within the ear, doctors call it primary otalgia. If it originates outside the ear, the term is secondary otalgia. In this video, we describe the many possible causes and their accompanying symptoms, and to prevent ear pain. Causes. Some causes of a sharp pain in the ear. The pain may result from one or a combination of these factors. Each ear contains a narrow tube called a Eustachian tube. It helps regulate the pressure inside the ear so that it matches the air pressure outside, enabling the eardrum to function properly. Sometimes there is an imbalance in pressure which may result from a blocked Eustachian tube or a change in air pressure or altitude. External pressure changes can cause a type of temporary ear damage called ear barotrauma. The symptoms can include a feeling of pressure within the ear, a sharp or dull pain in the ear, hearing loss, dizziness. Sinus infections. A sharp pain in the ear can sometimes result from an infection in the sinuses, a network of air-filled cavities in the skull. There are three major types of sinus infection. They are otitis, infection and inflammation of the ear, and the most common type of sinus infection, mastoiditis, infection of the mastoid bone behind the ear. Sinusitis, inflammation of one or more paranasal sinuses which are responsible for producing nasal mucus. Sinus infections may be viral or bacterial. Otitis. This, an infection in the inner or the outer ear, is one of the most common causes of ear pain. An infection of the inner ear affects the Eustachian tube, which connects the middle ear to the back of the nasal cavity and the upper throat. This usually has a viral cause and is most common among children. An infection of the outer ear affects the ear canal, the tube that connects the outer ear and eardrum. The infection usually involves direct irritation of the ear canal, such as from water or objects such as Q-tips. It is most common in adults. Besides sharp pain, some possible symptoms of an ear infection include difficulty hearing, a feeling of pressure or fullness in the ear, discharge from the ear, itchiness or irritation in and around the ear, a fever, low energy. Temporomandibular disorder or TMD is a musculoskeletal condition that primarily affects the joints that connect the jawbone to the skull. People with TMD may experience sharp or dull jaw pain that radiates to the ears and temples. Other possible symptoms of TMD include clicking, popping, or grinding noises when moving the jaw, difficulty opening the mouth fully, the jaw locking when opening the mouth. TMD is not usually serious and tends to get better on its own. A foreign object in the ear. A foreign object may become stuck in the ear canal. Children, for example, prone to inserting objects into their ears out of curiosity. A foreign object lodged in the ear can cause sharp or dull pain, drainage from the ear, hearing loss, and infection. A person attempting to remove the object at home could inadvertently push it further into the ear canal. Instead, See a healthcare provider who uses specially developed tools and procedures to remove these objects. Symptoms. Depending on the cause of the ear pain, a person may also experience a loss of hearing, tinnitus, which involves perceiving noises that come from inside the ear, a loss of balance, vertigo, facial nerve paralysis. A person may only experience sharp ear pain in certain situations, such as when yawning or swallowing. These motions open the eustachian tubes, changing the pressure within the ear. Home remedies. Over-the-counter pain relief medication can help ease minor to moderate ear pain and discomfort. Also, holding a warm or cool compress against their ear may help alleviate the pain. Some people use Q-tips to try to remove ear wax, but this can actually push the wax back into the ear canal, causing problems. Anyone concerned about ear wax build-ups should see a doctor. Prevention. Ear infections are often responsible for a sharp pain in the ears, and these infections can be tricky to prevent. However, it can help to not probe the ears with Q-tips or fingers. Prevent water and shampoo from entering the ears when showering or bathing. Use earplugs or a swimming cap when swimming. Treat eczema and other skin conditions. Treat any allergies to materials in hearing aids if a person wears them. Avoid smoking and smoky environments. To prevent ear pain caused by changes in external pressure or altitude, try yawning, swallowing, chewing gum, sucking on hard candy, blowing gently through pinched nostrils and swallowing. This can help open up the eustachian tubes, equalizing the pressure inside and outside the ear. When to see a doctor. Sharp ear pain may resolve on its own, but if the pain is severe or the ear is bleeding, the person needs immediate medical care. If someone experiences any of the following, they should consult a doctor. An earache that persists for more than 3 days, recurrent ear infections, swelling around the ear, fluid draining from the ear, hearing loss or another change in hearing, a severe sore throat, vomiting, dizziness, a fever or chills. Also, if sharp ear pain occurs in someone with any of the following health issues, they should see a doctor. Diabetes, a neurological disease, heart disease, lung disease, kidney disease, a weakened immune system.